Good morning. They gave me 10 minutes, I think. I can talk for an hour easily about hospice, but in 10 minutes is kind of hard to tell exactly what level we can get to. But I started Waynesville Family Practice in 1982, and we're still very active there, have 8 practitioners. In '83, we started the forming of the hospice here and had to go through the whole 501c3 program to get through the state. Started seeing patients in '85, and I was just doing a little part-time then. I'm doing half-time hospice now. Some of what I do is go into the home for home visits when patients really need help with their care there. And then the rest of my time is at the homestead. We're going to be showing you pictures of the homestead. It's a beautiful place. It was basically built by the community for the most part. Donations over years and years from families that were pleased with their care, and then some grants, and then support from the hospital in the end to donate land, and some help with the finances at the end. But it's a beautiful facility. We can house 6 inpatients at a time. So I want to start with a little bit more groundwork. I'm sure everybody knows what hospice is. A lot of people flinch when we mention it. So it's a hard sell sometimes, but hospice does wonderful work in trying to make whatever time people have left the best quality it can be. So we help with symptom management, help the families adjust to the idea, offer a lot of different services. To have hospice, though, you have to be within 6 months of death. So that's the hard part, is nobody wants to say they're within 6 months of death. Doctors don't like to talk about it. Studies have been done that show that the doctor who knows you the best, I've been here almost 5 years seeing patients, I'm least likely to get the prognosis right. I'm going to think you're going to be here a lot longer than you really are, because we get attached so much that we want to, just like family, it's really hard to make those decisions. So somebody on the outside, so if I go do a consult, I can look through your medical information and your exam and tell a whole lot more accurately if it's time. But we try to get people to think about it themselves. Would you be surprised if this friend or family member was dead in 6 months? It's a pretty easy question. It's just some people just look sick and you think, well, yeah, I wouldn't be surprised if I heard that they had died. That patient's ready for hospice, probably well past ready. Do y'all know what palliative care is? Palliative care is comfort care. It doesn't have as strict restrictions. It can start 18 months, 2 years ahead. But it's for really chronically ill patients, severely ill, need symptom management, need things worked out. We can provide it in the home, or if you have family members or friends that are in nursing homes and their symptoms aren't well controlled, there's a lot of unsettled issues, palliative care, we can send the nurse practitioner in and get that started. And then if they're on palliative care, it's a lot easier for that person to say, yeah, it's time to move on into hospice at some point and make that transition much more smoothly. So the hospital is supporting a nurse practitioner now, and she's about full. We're hoping that we're going to be able to add to that program to fill it out more. A lot of the times it's consults in the hospital where the patient's really sick. They've been in the hospital every month for their heart failure. Can't get better. That's probably time to be thinking about getting a palliative care consult in there, and they help them figure out what their goals of care are. So basically, some people, they don't care whatever happens, they want everything done. Well, a lot of people don't want that. A lot of people don't want to die in ICU, intubated and still in pain. It's not what we wish for ourselves, but a lot of people don't make plans ahead of time to avoid that. So that's one of the things we do, is when people are going back to the hospital, we can help manage that at home. We've had patients that we're going every month. We get them in hospice, we treat them at home for those same kind of symptoms, But we have nurses going out all the time, so we can catch the symptoms early, keep out of the hospital. We have patients go for 2-3 years in hospice. You don't have to promise to die to be in hospice. We have people that graduate, we get them better, they get such good care with hospice, we have to kick them out. They're just doing too well. And some people go for years. They're gradually weakening, but they're not going back to the hospital anymore. They're not getting in ICU. They're not having a bunch of aggressive treatment. Same thing with chronic lung disease. And sometimes you get to that last time when you just can't come back. Sometimes that's when we move on to the homestead. We want to talk more about that, but homestead can help in a lot of different ways. One is getting patients out of that hospital setting. They've done all the aggressive stuff, nothing's working, they can't get better, their symptoms aren't controlled. Well, we take them to the homestead, and a lot of times they get better when they roll in the door, because it's a beautiful place and very calming, and the nurses know exactly what they're doing. So people that are agitated and 4-point restraints tied down in ICU come over and they calm down very quickly. We get the right medicines in and try and improve that quality of life. And it may be only a day or two that they survive, but they're much more, I mean, you can choose which way would you want to go. Symptoms controlled, comfortable situation, expert nurses controlling your symptoms, or staying in the hospital. So hospitals are loud and bells and whistles and get stuck by needles all the time. It's great if you have to have that, but at a certain point in time, you don't really want that approach anymore. The other way we use hospice is if we have patients at home. 90% of our patients are in the home or nursing home, don't ever come into the homestead. But sometimes they're at home, they get symptoms out of control, everybody's up all night, they can't get it. So we bring them in, get the symptoms under control, and then send them right back home. Or we help them decide, they sometimes come in and say, can't do it anymore. So we work out a placement in a nursing home or get them hired caregivers to do it at home better. So a lot of things we can do there. One is just respite. We have patients come in all the time. Patients' families doing a great job at home, but if you've ever done that kind of care, it's exhausting. So at certain points, we just have them come in and we babysit. So the patient can stay there 5 days while the family goes to Disney World if they want, or if they just want to get some rest at night and come in and see them during the day. But it's a set 5-day thing. But you can do it every month or two. So it really helps to keep people at home. If the family gets that rest periodically, then they can do it again and take care of that patient well. So we're just trying to figure out the best setting in which to take care of the patients. So that's the basics of it. One thing that just is kind of crazy is y'all are businessmen and you know, businessmen and women, insurance. Well, this is one of the best insurance programs there is. The hospice, if you need it, provides the nursing care, chaplains, volunteers, social workers, music therapy, all the equipment's paid for. Most all your medicines that are associated with your illness are paid for. So it's this wonderful insurance program that you've already paid for. It's from Medicare or all the major insurances already cover it. So it's not like you could buy a really expensive long-term care policy. You've already paid for it, but we don't have near the numbers that we like to use in hospice. So some of it's fear or people just not wanting to talk about it, but it's a wonderful program that does a whole lot of good. And when I say we want more people in hospice, people say, ooh, more people dying. Everybody's going to die. We just want them to die better, so we can help. A lot of times, like I said, doctors don't like to talk about it too much sometimes. So a lot of times it's up to you. If you have family members or friends that look like they need help, a lot of times the person has to go ask the doctor, we think it's time to get a palliative consult, or we think it's time to talk to hospice. And we can come out and do a consult, see if it's really appropriate, and take care of it. Thank you.